Hello, everyone, and welcome to another chat by Mom Says. I am very excited to have my dentist with me today, Dr. Desai. She is a dentist based in Johannesburg, and we're just going to be chatting about dental care. So, welcome, Dr. Desai, to the Mom Says tribe.
Hi, thanks, Shaini. Thank you for having me.
I'm so excited to have you, and not only because you are my dentist, because I trust you 110% with my teeth and everything, and because I just think you're so awesome at what you do. So, I just wanted to chat quickly about dental care, at home, especially now since everyone is in lockdown and, we are eating more than we should be eating. I'm trying to behave with the chocolates and stuff because of the braces. But yeah, so I do have a few questions for you. But before I do ask you those questions, I just want to remind everyone that's watching, you can win a year's supply from Jordan. I'm talking toothpaste and toothbrushes for the entire family. All you need to do is like this post, share, and tag a friend in the comment section because they might find this video really helpful. So, Dr. Desai, I'm going to get straight into it. And I think my first question is quite predictable for you, but lots of people argue on this, on how many times a day should you brush your teeth with and without braces?
So everyone should actually brush their teeth twice a day. This should include flossing, brushing, as well as using a mouthwash. If you have braces, you should brush your teeth at least after every meal.
Wow. Okay. So I basically eat 3 times a day, so I have to brush my teeth 3 times a day. Okay, I've been doing that. I've been behaving. Okay, so you mentioned flossing, which a lot of people don't find has something important to do. And I know I've got an electric flosser, which works really well for me with braces. But is flossing a must have even for our kids?
Oh, yes, definitely. Look, everyone should floss at least once a day. I definitely recommend it. In terms of your children, as soon as their permanent teeth are in the mouth, I would definitely recommend introducing the concept of flossing to them.
Okay, let's talk about toothbrushes and toothpaste because there's the whole electric versus manual one. Does it matter what toothbrush and toothpaste I use?
Look, it definitely does matter what toothpaste you should use. So you get 3 different types of toothpaste. You get a hard bristle brush, medium bristle brush, as well as a soft bristle brush. I would definitely recommend that people who use a soft bristle brush. Hard bristle brushes generally cause a lot of if not used correctly. So it's essentially about it's not about how hard your toothbrush is. It's actually about the technique of brushing. In terms of toothpaste, everyone has different requirements. I would strongly suggest that you actually visit your dentist and actually find a toothpaste as well as a toothbrush that would actually meet your requirements.
Okay, great. Now talking about toothpaste, there's fluoride and there's non-fluoride, and it's very confusing for me. So I need you to fill me in on what's the difference and does it really matter?
So fluoride is a mineral that is found in pretty much supply in South Africa. So fluoride helps in the remineralization of weakened teeth, the enamel. It slows down the loss of minerals from the enamel versus the signs of tooth decay, and it prevents the growth of harmful bacteria. So I would also highly recommend people using a toothpaste with fluoride.
Okay, what about mouthwash though? Because that's also something that has fluoride or non-fluoride. I've heard this whole thing about having alcohol in the mouthwash that can actually work against you. Is that true?
So with regards to the alcohol in the mouthwash, you must remember alcohol does dehydrate the gingiva. So it's definitely not recommended to use mouthwash, especially if you have a dry oral cavity. Firstly, Jenny, I would also recommend that, I would also like to mention that a mouthwash does not replace any form of brushing or flossing. Certain mouthwashes help in freshening up the breath, killing bacteria, as well as preventing plaque buildup. Look, the benefit of fluoridated mouthwash is that it actually removes plaque. It doesn't work. The benefit of it is that it removes plaque. It actually helps protect your teeth from certain acids, and that acids are produced by the dental plaque, and it helps in washing that away. It aids in remineralization of teeth.
Talk about all the other problems that comes with having a set of teeth. Well, I think everyone has problems at some point in their life, but how do you prevent the tooth decay and all the other things that we mentioned a little bit earlier?
Well, firstly, I would recommend that everyone has a really good or instills a really good oral hygiene regime. If you brush your teeth twice a day, floss your teeth, and as well as use a mouth any problems. I'd also highly recommend that you actually visit your dentist twice a year. This can pick up on the start of any early day. They can also help in further damage to your teeth.
Okay, so another question is, why should I have dental x-rays taken? Is this an important thing when you go to visit the dentist, especially for the first time?
Oh, yes, definitely. Look, I would recommend taking x-rays at least once a year. X-rays help the dentist actually identify certain problems. For example, when the patient comes and takes a seat in my chair, I cannot identify if there's actually bacterial cavities in between the teeth. So what the x-rays will help us do, they'll actually help us identify if there's the start of any cavities in between teeth. Number one, it'll help us assess the actual integrity of the bone that holds the teeth. It'll also help us indicate, or it will assess the integrity of the surrounding tooth structure, and it will help us assess any old fillings, if there's actually underneath those old fillings, or if they need to be replaced.
Okay, what about tooth sensitivity, and why do some people have it? Like, I know before, when I used to eat ice cream, then it will just like knock my teeth a little, and I'm like, ooh, what is that?
Okay, so there are different layers of the teeth. Our tooth is called the enamel. The second layer is called the dentine. So tooth sensitivity could be as a result of multiple factors. It could be as a result of forceful brushing of your teeth, using an incorrect toothbrush, any acids that could actually eat away at the enamel. It could be due to gum disease or tooth decay. So I would actually highly recommend you visit your dentist to actually diagnose the reason for your tooth sensitivity.
Okay, so I'm curious to know, what does a dentist do like during the first checkup? And I also have to ask this question. Like, I've noticed dentists tend to have conversations while they have patients sitting on their chair. Like, we do it all the time, and I'm like, So is that a thing? Like, why do dentists do that? Like, someone said I should ask you this question, so I just had to ask you.
Look, I'm not sure about any other dentist, but I generally love having a conversation with my patients while they're on my dental chair. I know I generally don't expect a response, but I like conversing with you, so you get an idea of my personality, as well as sometimes I kind of, along the way, would just like to know, what are your thoughts? And I like explaining things along the way. So essentially what you would do if you come and visit my practice, you'd have a seat about your previous dental history. I would actually have a look inside your mouth. I would take x-rays at least once a year, and I would generally do a dental cleaning. And in that appointment, I'd also tell you if there's the start of any bacterial chest periodontal disease, otherwise known as gum disease. I'd also inform you if you're starting to get any cavities, and I would actually help you and see if you actually brushing your teeth correctly. So I would actually give you a little bit of oral hygiene instruction in order to help you aid in your oral hygiene regime. Thereafter, we do a fluoride treatment. So in the fluoride treatment, we just place a high concentration fluoride gel into a tray and we place it in your mouth for about a minute, and that will help in the remineralization of your teeth. Yeah, that's pretty much what we do in the dental cup.
Okay, nothing too hectic. So we shouldn't be scared of going to the dentist for the first time, because I know that's a thing. People are legit scared of going to the dentist because, you know, they like dentist equals pain.
I think they're not going to the correct dentist. That's why they're getting that perception.
That could be a good one too. Okay, what are your thoughts on teeth whitening? Now, I've been reading up a lot about this because I have braces, and I've noticed that with braces, my teeth kind of look a little yellow. I know that, you know, the elastics play a role in that as well. But I've been reading about like, oh, after you take out your braces, you should consider teeth whitening because, you know, you end up with those little blocks or whatever. But generally, like people that don't use braces as well, is teeth whitening a thing? Should they consider it?
Look, tooth whitening is definitely a thing. Firstly, I'd like to mention that I would not recommend going to see anyone other than a dentist for tooth whitening. So I would not recommend you going to see a beautician, ordering anything online. Many of those products are not trusted, and you do not have the correct tools to actually use those tooth whitening sets. That's number one. Number two, tooth whitening is essentially when we place high concentrations of either hydrogen peroxide or carbamide peroxide on your teeth, and we leave it there for a set period of time in order to actually whiten your teeth. Just remember that tooth whitening is not a permanent solution. It is semi-permanent, so it can last between 6 months to a year, depending on your diet. The only downside of tooth whitening is that it can cause a little bit of sensitivity. And yeah, so it depends on what your needs are. If you would like a brighter smile, definitely I would recommend visiting your dentist in order to actually give you either an at-home or an in-office tooth whitening set.
Okay, so let's talk about babies now. Some of them get their first tooth at a very young age, and mommy's also not sure, should I brush that tooth? Shouldn't I? Like, what's the appropriate age to start brushing your little one's teeth?
So essentially, I would recommend, must remember that oral hygiene starts before any teeth are present in the mouth. So once your baby's born, I would recommend using either a rubber bristle brush or a soft, wet face cloth or a dampened gauze, and you actually just wipe your gums of your baby after every feed. Thereafter, I would recommend using a small bristle brush, a soft, small-headed with a very large handled bristle brush, and you should brush your teeth. You should brush your child's teeth after their first 2 years in their mouth.
Okay, so at what age should my child see the dentist for the first time?
Actually, the minute they have developed their first baby tooth, I would recommend them visiting their dentist. Prior to that, I would ask all parents to maybe let them read a book about visiting their first dental visit, or watching a video. I know Peppa Pig, everyone has a little bit of an episode on their first dental visits. I would recommend parents letting their child watch their first dental appointment visit and then coming to see the dentist the minute the first tooth appears in their mouth. Therefore, the dentist, I can actually form a good rapport with the child as well as the parents.
Wow, really? I legit did not know that, because my youngest is 4. Of course, he's never been to you yet, because I thought he was just too young to visit a dentist. But I guess I need to take it to the dentist. When do baby teeth typically fall out?
So baby teeth typically fall out, well, they generally fall out between the ages of 6 years to 12 years old. children lose their teeth once they permanently start developing, and over time, the permanent tooth eats away at the roots of the baby tooth and pushes the tooth out. We must remember that everyone ages slightly different, so everyone will start losing their baby teeth at a different age, but between the ages of 6 to 12 years old, they'll lose their baby teeth.
Awesome. Thank you so much, Dr. Desai, for chatting to us this evening. It's always awesome chatting to you. Just a quick one before you go. Where can we find you?
You can actually just Google us. You can just Google my name, Dr. Jainisha Desai, or Dr. Jainisha Desai, and you can actually find us at the NHC Bryanston. But yes, that's how you can contact us.
Awesome. Thank you so much for answering all our questions. And I guess I will be seeing you soon for my checkup. But other than that, stay safe and we'll chat soon. Thank you so much.
Thank you. Thanks a lot for doing this, Shani. Keep well. Bye.
You too. Bye. So that was Dr. Desai chatting to us about how to have good dental hygiene at home. I hope you learned a thing or two from her. I just want to say thank you so much for joining us today. But remember that you can win a year's supply of Jordan products for the entire family. All you need to do is like, share, and comment on this video. Tag a friend or two that will learn something about dental care. And invite your friends to join the tribe. Remember, you can find us on www.momsays.co.za. Until next time, stay safe and we'll chat soon. Bye.